Good afternoon, ladies and gentlemen. Welcome to our medical education program. We have with us one of our own today, Dr. Shelub. He is a specialist in infectious disease and has been with us for close to 3 years right now. He does most of the infectious disease work at the hospital. And he will talk to us today on an important topic now that summer is coming. And his lecture is titled Travel Medicine and the Pre-Travel Consultation. Dr. Shelub.
Thank you, Dr. Vesey, for introducing me, and thanks for coming. I think travel medicine is an up-and-coming field. It's one of these things you may have to consider as a primary care doctor. Patients will come into the office and telling you they're traveling internationally. For instance, people are going more and more often to Africa, Southeast Asia, Central and South America. You guys hear me? Some people feel more comfortable doing this type of medicine, and some people feel less comfortable. So if it's something you feel like you can do in the office, I'll show you how to do it. If not, there's several travel medicine clinics in the area, including myself.
It's not really clear. I don't know what it is.
Oh, okay. Can you hear me now?
Yeah, that's better.
Better? Okay. What I said was that some people feel comfortable doing travel medicine in the office, some people less so. If you're one of those people who want to do it, I can show you the resources where you can actually find out what you need to know. Secondarily, if you're one of the people who feels less comfortable, you can actually refer to a travel clinic. Myself, other clinics in the area. Can you hear me now? Yeah. Okay. Does anybody know where this is? That's right, Peru. I was there in 2006. And I actually got traveler's diarrhea. Machu Picchu is in Peru. It's a beautiful hidden city that was found in the end of the 19th century, I believe, by Hiram Bingham when he was exploring. I travel up there, you can hike. It's one of the more adventurous activities people are doing. And this is why this is an important topic. Turns out that more and more people are traveling internationally. So what do I want to talk about today? For those of you unfamiliar with travel medicine, I'll touch briefly on some of these topics. I can't cover each and every disease because that would be the whole yellow book. The yellow book is the CDC guide to prevention of travel-related illness and injury. But I'll try to touch on some of the more pertinent topics, some of the epidemiology, how to assess a traveler, review their itinerary, where you can get information if you need help, the risks you need to know that travelers will be exposed to, common diseases of concern, travel vaccines, which everybody seems to be aware of, travel medications and counseling. However, I have to say that travel medicine is much more than just travel vaccines. It's a fascinating topic, and it's something that's going to become more and more important. So how many people are actually traveling abroad? Well, I had somebody come up to me today and tell me they're going to Africa. I see probably several people in the clinic each week, and I haven't really started to advertise. Most assumptions are that infectious disease doctors know and do travel medicine. And some of them do, some of them don't. I actually have an interest in it, and some other doctors in the area I'm sure do too. Now, there are approximately 61 million people who traveled in the United States internationally, from the United States internationally via World Transportation Organization estimate. And you can see each and every year, the number, meaning millions of people who are traveling, becomes more and more. 2005 is what this study was based on. It's around 64 million. Again, I said in 2009, based on WTO estimates, it's 61 million. Everybody hear me okay? Oops. Okay. 880 million people are traveling internationally every year. 880 million people are leaving their home country traveling. The greatest risk is going from a westernized country, an industrialized nation, to a less developed nation. That's where most of the health risks are associated. Where do U.S. residents travel? Well, Canada, that's not associated with a high risk. Europe, not associated with a high risk. Mexico, actually associated with several different risks, which we'll get into. Central and South America, Japan, less risky. Africa, Caribbean, and Middle East. Now, what do I mean when I say less risky? Well, it's all going to be based on your point of reference. What is risk? It turns out that travel medicine is one of the new fields that we do not have a lot of great studies for. And the evaluation of risk is somewhat subjective, meaning that what one person considers to be risky, another person may not consider to be risky. Meaning that if you were going to go and trek in Nepal, 15 out of 100,000 people will become seriously ill. 15 out of 100,000 people trekking in Nepal. What's fascinating is that one person who reviewed that same article said, well, this needs to show how risky it is to trek in Nepal. The second reviewer said, this needs to show how safe it is to trek in Nepal. So the idea of risk is somewhat subjective. The studies that we have are very difficult to interpret and extrapolate because it's hard to get a very good denominator. It's hard to figure out how many people travel to a specific location and actually become ill with such and such illness. So a lot of these are based on expert opinion. Some of the basic data we have from studies in the 70s and 80s. Your chance of dying when you hike Mount Everest is 1 in 40. This is a group of people that we need to be especially aware of because these are the people who are the highest risk. These are the people who come from these third world countries. They come from Southeast Asia, they come from Africa, they come from South America. That's where they were born, and they assume that they're immune to these diseases. It turns out their immunity is waning. They should consider vaccination. They should consider malaria prophylaxis. Visiting friends and relatives is what they're referred to. 57% since 1990, from 19.8 million to 31.1 million people fall into this category. The numbers now probably are even higher. 20% of the U.S. population are first or second generation immigrants, meaning that a lot of people will be doing this. Very common for people, I would see it, all of you would be in the clinic, and then the next week they would travel to South America or Central America. And I'm not sure how many of these people ever looked into getting a free travel consultation. 46% of U.S. travelers are probably in this category, based on 2004. So here's some numbers about risk. Again, risk is subjective. 50,000 will develop some health problem out of 100,000 people. Fairly high percentage. Most of the time it's going to be travelers' diarrhea. 8,000 people will end up seeing a physician. 5,000 people will end up confined to being in bed. 1,000 will be incapacitated in their work. 300 will be admitted to a hospital. 50 people will be air evacuated. That's something I'll talk about more. Consideration that most people don't take into account is you can buy health insurance and evacuation insurance. To be evacuated costs between $50,000 and $100,000. And there are people who are going to places, and I'm not talking about only young people, that you could consider being ready to be evacuated. I know a local cardiologist who went trekking looking for gorillas in East Africa. And he asked me right before he went, he said, do you think I should get any vaccination? I said, yeah, I think so. He actually bought evacuation insurance. For the cost, it's probably useful, depending on where you're going. One person will die in 100,000. So I'm not trying to throw a damper on this. I love to travel. As you can see, I went to Machu Picchu. I love to go to South America. I've been to Argentina. I've been all over the Middle East. I've been all over Indonesia and Southeast Asia. Is the mic okay? It's okay? Okay, just want to make sure. Okay, so estimated incidence rate per month of infections or fatal accidents among travelers. As I alluded to, the highest risk is going to be travelers' diarrhea, malaria, influenza, and dengue. People will convert their PPD. Hepatitis A, the risk is actually less than 0.1%. Typhoid is low. Tick-borne encephalitis is low. HIV infection is low, depending on what you're doing. And then there's the other ones. Now, the caveat here is the risk may be low to get Japanese encephalitis. But if you get Japanese encephalitis, we're talking about a whole other category of risk. Severe disease. Severe disease, same thing with meningococcal meningitis. People are traveling to the Hajj every year. Hundreds of people die every year. Polio. You would suspect that polio doesn't even exist. It turns out polio does exist, mostly because there hasn't been a full vaccination program in Nigeria, which they're hoping to complete. These are your general lists. This slide was actually hard to incorporate, but basically I just wanted to show you. Diarrhea is the highest risk no matter where you're going. You're probably got a 22 to 64% chance of getting traveler's diarrhea based on your travels. Okay, I've gotten it. I actually had to fly back from Peru with a fairly significant case of viral gastroenteritis, which I think may be traveler's diarrhea associated with the virus. It was not pleasant. But I'll talk about more things you can do to avoid it. The other thing I thought was interesting is that there's a significant number of patients, it's really very hard to see, who will end up getting respiratory infections, chronic diarrhea, and then here's some of the more virulent things you can get that are uncommon. Maybe 30 out of 1,000 people who come back ill will get something like this. But the effect is catastrophic. I'm talking about things like malaria, yellow fever, dengue not so much, but those are also considerations. And also Japanese encephalitis, meningococcal meningitis. I like this picture because I feel like I look like Vasco da Gama. You know, just like pointing. I can take one question. You know, I just wanted to say, if you can hold the questions to the end. Is this an urgent one? Can we wait? Okay. Okay. That was back in Peru. Okay, so what do you need to know if you're going to do a travel medicine evaluation? Well, basically, how old is the patient? The patient's elderly, they're older than 65. They are somewhat immunosuppressed. You have to take that into consideration, especially with the type of vaccine. Underlying illness or immunosuppression. How are they feeling currently? What's their medication history? Do they have any allergies? Do they have any contraindications to vaccines or medications? Obviously, if a woman comes in who's fairly young, you want to consider, could she be pregnant? Is she planning on getting pregnant? It's a high-risk endeavor to be going to a malarious area if you're pregnant or becoming pregnant. It's generally not recommended. Preconception, obviously, needs to be considered. Risk-taking behaviors. You'd be surprised what I see. I have people come into the office telling me what their plans are the more I do this. I had a gentleman in his 50s come in and told me that he was going to go to Southeast Asia. I took a few extra minutes. I was interested. I asked him what his plans were. He told me that he was going to have sex with prostitutes, intentionally. So people have a lot of interesting ideas of what their travel plans are going to comprise. Obviously, that's one of the things that a lot of people look forward to. They want to have a good time and they want to enjoy themselves. But there are definite risks inherent with that. I had to tell him, you know, the risks are there. He was under the impression that getting HIV that way was low risk. I told him that it's fairly low risk, but it's not no risk. What are they doing? Where are they going? What are they planning on doing? Are they going to be outside all the time? Are they going to be camping? Are they going to be in a 5-star hotel, being bussed in an air-conditioned bus from place to place? Are they going to be on business meetings only? Are they going to be doing adventure? Are they going to be doing sexual or medical tourism? That's another fascinating topic. People are going to third world countries and getting surgery done. I had a woman come in and see me at another local hospital. She had a tummy tuck down in Mexico. I got infected. Of course, she had no insurance, but we're left here holding the bag, right? So people are doing these things. It's something you need to be aware of. The other fascinating thing about that case was that most people don't realize that in a lot of these countries, they reuse needles. They reuse needles. Not every country, and it depends on the clinic, but a lot of places that are supposed to be using disposable needles reuse them. So that's one thing you have to be able to emphasize to patients. The more you can just let people know, you can sort of subtly affect their risk-taking behavior. Maybe it'll be in the back of their mind, maybe it'll just make them think twice about doing something, getting that tattoo, getting that piercing in a third world country, getting on that motorcycle drunk without a helmet. Does anybody know where this is? Joshua Trek, that's right. I love hiking there. Okay, so these are some of the resources you can use. CDC travel website is really just fantastic. I mean, if you take the time to look into it and learn about it, I just love looking on this site. They'll teach you almost everything you need to know. You can look at the World Health Organization, State Health Department has a site. There's also a society called International Travel Society of Medicine, which is working with the CDC to create new studies called the Geo Sentinel Study Group. It's about 17,000 travelers who have returned and they're being evaluated for clinical illness. And the most important book I think you can get is the Yellow Book here, which I've been using from 2012. this just gives you an idea of what's going on with the website, destinations, tells you vaccinations, diseases, yellow book, find a clinic, start staying healthy when you travel. This is the destinations page. It's very easy. Somebody comes in the office and tells you, hey, listen, I'm going to such and such. You just quickly click on there. Where is it in South America? Where is it Central America? Where is it in Africa or Asia? And it'll tell you what you need to know. This will give you an idea of what the most recent travel announcements are. Dengue fever, for instance, outbreak recently in March, May rather, in subtropical areas. Okay, so having said all that, and everybody thinks about travel medicine, watch out for diseases, the reality is you're 10 times more likely to be hurt or injured in a car accident in a foreign country than get any other infectious disease illness. That's just a statistical fact. And that's because people tend to drive not as well in these third world countries. The road conditions are not as good. There's more traffic. It's more dangerous. Road traffic killed about 700 or so people from 2007 to 2009. This is the leading cause of U.S. death while traveling. Homicide. I heard a fascinating piece on the BBC the other day that suggested that in Honduras, the murder rate is somewhere around 84 per 100,000. Probably like 10 times the rate of Britain. I mean, they don't even have money to bury people. So, obviously, people should be aware of this. Somebody came and told me they're going to go to Honduras or Central America. I tell them, you gotta really watch out. Americans are especially high targeted because, for the most part, we don't travel as much internationally. People tend to be naive about the risk. You may wear expensive clothing. You have to avoid these types of behaviors. This is all actually part of a pre-travel consultation. Most people don't realize, this is what goes into it for a really good pre-travel consultation. Drowning is another common one. People, relax. They go to the beach, they have drinks, they get in the ocean. People drown. People drown. Suicide, people have culture shock. That's probably more of a long-term issue. Aviation, I thought was a very funny chapter. It's not funny, but it's interesting the way they put it. I mean, in general, avoid going on unscheduled flights in third world countries at night. The plane maintenance is questionable. It probably is questionable. It's generally not advised. Use major carriers. Drug-related, people start using drugs. It turns out terrorism is probably your lowest risk. All others includes infectious diseases. Okay, so how do the estimated traffic deaths break down? So in Mexico, there's around 22,000 traffic deaths a year. It's about 20.7 per 100,000. Thailand, about 19.6. India, looks like a terrible number. And in reality, if you look at the rate, it's about 16.8. The US is around 13.9. It's about 42,000 fatalities a year. So what about infectious disease risks? That's the field that I'm probably the most apt in. Malaria, diarrhea, leishmaniasis less common, rabies, catastrophic if you get it. You're probably not going to survive. It's unlikely you will get it. Dengue fever is more of a nuisance, but it does have a severe complication. As I mentioned, meningococcal meningitis, the meningitis belt in sub-Saharan Africa, schistosomiasis, tuberculosis, and the others like yellow fever, measles, right? That's the other thing that's fascinating about these vaccination or these diseases that can be vaccine prevented. People are not doing vaccines as much as they used to. People are not doing vaccines as much as they used to. People are traveling to areas where there are more of these diseases endemic. So that means that we need to be more aware of the fact that people can get these diseases. Turns out at a local hospital here, in the emergency room, there were 3 cases of measles. I'm talking about last month at a local hospital. So people aren't getting vaccinated, they're traveling to other places, they're bringing them here. Herd immunity is down because people aren't getting vaccinated. So there's a chance that people can actually be diagnosed with these diseases. It's another reason when you come in for a pre-travel consultation, you can find out what are people's vaccination history. Did they know if they've been vaccinated to MMR? Did they know if they've been up to date with their Tdap? Have they had their influenza vaccination? What about their hepatitis A and hepatitis B status if they're at risk? Is the microphone okay? Can you hear me? Okay. Other risks we touched on, crime and assault. I'll tell you a funny story. Crime and assault is highest in some of these more poor countries, obviously like Eastern Europe or Central America. I had an experience where I went to Czech Republic. I took a taxi to a fairly low-class area for a cheap hostel with a friend. I gave the taxi driver a big bill at the end, and I immediately realized that I made a mistake. And he looked at me and said, "Okay, thank you." And so I wanted the change, right? Very clear he was not intent on giving me any change. We're talking about 40, 50 bucks. And I started to argue, and then it was funny, it was a sixth sense just kicked in and said to me, "You know what? You should just get out of here right now." So there are risks. There are definitely risks out there. Turned out I got out of there, everything was okay. But in general, if somebody comes up and wants your money, the advice is to just give it to them, especially if you're out of your own context. Psychiatric problems, people have psychiatric breakdowns commonly, they're not taking their medications especially. Animal bites and stings, dermatological disorders, altitude sickness, which I'll touch on. Altitude sickness is actually a common illness. When I went hiking in Machu Picchu, I took Diamox. My friends didn't. And it was funny because the second day, we started really going up quickly. We went from like 8,000 to 14,000 feet within a day, which is not recommended, but that's the way the trip was scheduled. And I'll tell you something, my friend was fairly young. I was 31, he was probably 30, but he was not in great shape. He didn't take Diamox. He was actually wearing an oxygen mask on the way up because he was that hypoxic. So these things are risks. I saw plenty of people being turned around. So that's another thing you can help people prevent. You can give people Diamox, you can help them with jet lag, you can help them avoid all these little things that are nuisances, or can even ruin your trip. Okay, let's take a little break and do a case. Let's see if you guys have come across this. And this is a real case, actually. Saw it just recently at a local hospital. 38-year-old male, no significant past medical history, returns from Mexico with fever, fatigue, and muscle aches. He was camping outside in rural Mexico in the Baja Peninsula. He was on a vision quest. He's slightly neutropenic, he's anemic, he gets a lot of IV fluids, and he feels better. What are the few things you should think of? What's one of the main things you should think of here? Probably dengue fever, right? Malaria is uncommon in Mexico. Dengue fever is one of the most common things you'll see in a sick, returned febrile traveler. If you learn anything from this lecture, somebody comes back from a low or impoverished nation with a fever, malaise, headache, a little bit of rash, maybe some mild neutropenia, dengue fever. You can see in Central and South America predominant. There's also areas throughout Africa and Asia, Indian subcontinent, all the way through Indonesia and parts of Australia. It's a mosquito-driven disease. It's a RNA flavivirus, if you're interested in that. It's based on the bite of a mosquito. The World Health Organization estimates there's about 50 million cases of dengue every year. Infection rates are among febrile travelers returning is around 3 to 8%. Somebody comes back with febrile illness after recently traveling in the tropics or one of these areas, could probably be winning a dengue. Headache, retro pain, muscle aches, we touched on that. The one thing you need to be concerned about, and this gentleman actually got admitted because I was concerned that he was going to develop dengue shock syndrome. It's hard to predict what's going to happen. Some people will have these symptoms and get better. Some people will actually progress to having hypertension, narrow pulse pressure, and go into frank shock, and they need to be supported aggressively with IV fluids. Turned out when the next day I saw him, he was perfectly fine. Serologic testing, IgM is one way to do it. The problem is if you do it within the first 5 days, it may turn out to be negative. That was his case. I wanted him to come back for a follow-up. He didn't. I still suspect that he had dengue or anything else. Supportive care, anybody who comes in who has dengue, anybody who has dengue who develops abrupt change from fever to hypothermia, abdominal pain, persistent vomiting, or bleeding, altered mental status, you really have to get concerned about dengue shock syndrome or dengue hemorrhagic fever. Okay. When you get bitten by mosquitoes that cause things like dengue fever, it's usually going to be in the early morning. That's when the mosquitoes are out. They don't like to be out in the midday when it's hot. So that's a good piece of advice. Being out in the midday area is probably the safest time for mosquito bites. It's the highest risk for sunstroke. Several hours after daybreak, late afternoon, what can you use to get rid of it? You can buy DEET, where you put your sunscreen on first, then put on the DEET, because if you put on the sunscreen first, if you put on the DEET first, the sunscreen may not be as effective. Okay, immunizations we talked about. Oh, sorry, we alluded to briefly. Diphtheria, tetanus, pertussis, measles, mumps, rubella, varicella, pneumococcus. These are all basic things that everybody should be getting, right? But believe it or not, we're having less vaccination as more and more people become apprehensive. There's more and more disinformation out there. Now, travel-related things to consider. Hepatitis A, hepatitis B. People are going to Africa, Southeast Asia. If you haven't been vaccinated, the chance you're going to get it is low, but if you get it, it's going to ruin your trip. If you get hepatitis B, there's a 30 to 60% chance you're going to progress to chronic liver disease. So again, I have people come in who have not been vaccinated. They come in specifically to be vaccinated. Yeah?
Why hepatitis B if you're not going to have sex? Or...
Yeah, it depends again on your risk factors. You know, people are going to Southeast Asia to have sex with prostitutes.
No, but why?
This depends on the context. Hepatitis B, I see what you're getting at, in Africa in particular. I think one of the questions is, if you ever had to get a blood transfusion, you may not be vaccinated. If you ever have to get medical care in these places, some of the procedures may not be as good. You're having a risk of hepatitis B. Typhoid is another illness you can be vaccinated to, especially if you're going to be going to some of these areas I mentioned. Rabies, meningococcal disease, polio, these are all little nuances, which we'll get to. Okay, hepatitis A, person-to-person contact, contaminated water, it's shed in the feces, it's very common. There's no treatment, most people get better. Where are the areas you need to be considering hepatitis A? Central America, South America, South Africa, in particular Sub-Saharan Africa. There's some endemicity also in the Middle East, especially in India. How do you prevent it? People get vaccinated. It's fairly simple. It's 0, 6, and 12 months. You can be using Havrix. It should be actually, it should just be 0 or 6 to 12 months. Same thing with Vacta. And then Twinrix is the combination vaccine. It's hepatitis A and hepatitis B together. That's going to be 0, 1, and 6 months. Some people can't get vaccinated, and if they're going to be high risk, you consider using immunoglobulin. I haven't had that come up. Hepatitis B, people are going to be in contact with blood or bloody fluids. People are going to be doing medical work in foreign countries, and they're not vaccinated. Usually it takes about 90 days to become symptomatic. You get jaundice, nausea, vomiting, 30 to 90% chance of progressing to hepatitis B chronic. There's no treatment. It's vaccine preventable. It's a little bit different if you look at it. It's usually going to be in some areas where the Eskimos are inhabiting. Alaska, which is interesting. People in Iceland, Sub-Saharan Africa, certain parts of South America, and also Southeast Asia. A lot of people from Southeast Asia. China. I have a lot of people, not a lot, but I've seen a few people come in the office who are chronic hepatitis B carriers. Okay, typhoid fever. Any history buffs out there? It's an interesting part of. Does anybody know who Theodore Herzl was? One of the main founders in the Zionist movement. His sister died of typhoid fever. Anybody heard of typhoid Marys? So she was an asymptomatic carrier. A lot of people got sick. It's an acute life-threatening illness caused by salmonella typhi. Consumption of food or water that's contaminated by feces. There's about 22 million cases of typhoid fever a year. 200,000 people die. Okay? So basically, I've had people come in recently who are going to a safari in Africa, South Africa, Botswana, and I think it was Zambia. It's recommended you get vaccinated for typhoid fever. They didn't want to get vaccinated. I told them, well, you have to just understand the risk. The risk that you're going to get it is low. If you do get it, it could be catastrophic. It will definitely ruin your trip. And I've seen a case of this actually. I had a woman who was fall into the category of visiting a friend and relative at Olive. When I was training, went back to visit a family, I think it was somewhere in the Philippines. Came back with acute febrile illness, rose-colored spots, headache, high fevers, some hepatosplenomegaly. Turned out she had typhoid fever. He thought she was immune. Intestinal hemorrhage is a complication. It's a clinical diagnosis. Empiric treatment is a fluoroquinolone. How do you prevent it? You can take an oral vaccine. Most people don't 1, 2, most people will take the IM shot times 1. It should be renewed every 2 years. Anybody know where this was? Iguazu Falls, right. So I love to travel. I'm not trying to tell you don't travel. I'm just trying to tell you these are the things you can be aware of to make your travels even more enjoyable. So here I was, hiking around in the rainforest, walking around the falls. What's the one thing that's recommended here to get vaccinated for? And most people may or may not know. Yellow fever, right? I got vaccinated. The risk is fairly low, but if you're out there and you get a mosquito bite, you're in Iguazu Falls or parts of Brazil, turns out you can get very, very sick. The flavivirus, another vector-borne disease, it's caused by or spread by the Aedes or Haemococcus species mosquito. Epidemiological silence does not mean no risk, meaning that even though there may not be a high incidence reported, there still can be a significant risk. And you can be sure that if there's a high incidence reported and there's an outbreak, your risk is going to be even greater. So that means that a lot of these cases are not reported. Some cases may be asymptomatic. In fact, a lot of people have an asymptomatic case. But that means that there's a cycle that's continuing within that area, meaning that people are becoming bitten by remic, another mosquito bites them, it's spread to another person. So there's an endemic cycle that's continuing. So just because the numbers aren't there, doesn't mean that there's no risk. Non-specific flu-like illness, you get some fevers, you get some aches, you get some chills, you may get some nausea and vomiting, and you progress to a little bit of jaundice, and you progress to hemorrhagic shock. Multi-system failure, if you go into hepatorenal syndrome associated with yellow fever, 20 to 50% mortality rate. So these are the areas, that's where I was in Iguazu. People were traveling to either side of the border, Brazil, Paraguay, all parts of Brazil. There's been a recent outbreak in Brazil. There was a recent outbreak in the early 2000s in Maui. There was an outbreak in 2009 in Florida Keys because it gets spread. People travel to these areas, they become bitten, get by remic, it spread to local populations of mosquitoes. People can get it in this area as well. It's uncommon. We haven't had any cases in yellow fever here in the last several years in the United States. But it used to be endemic. In fact, if you're interested in history, the husband of Betsy Ross, the one who created the American flag, he died of yellow fever. So we've been able to clear a lot of these endemic diseases here in North America, but there's still a risk. These are parts of Africa you have to consider. Parts of Kenya you can see are covered here. All parts of sub-Saharan Africa. In general, the Western African countries are poor. Recommended. There's a difference between what's recommended, generally not recommended, and not recommended. So generally not recommended means it depends on what circumstances you're traveling. Okay, supportive care only. Again, the emphasis here is you get the disease, there's no treatment. Supportive care only. You can be vaccinated with yellow fever vaccination. It's an IM shot, 0.5 milligrams. Most people have no problem tolerating it. There are some occasional side effects. If you're obviously immunosuppressed, you shouldn't get it. As you get older, there's a slightly higher risk, but depends on the risk-benefit analysis. Several countries require this changes from year to year. It depends on what's going on epidemiologically. Travelers going through endemic countries, so if you go to a country that has yellow fever, you go to a place like South Africa, they will definitely make sure you have it, a vaccination, or they won't let you in the country. They don't want yellow fever spread in their country. Okay, here's another classic one, malaria. This is what a fully gorged mosquito looks like with blood. Transmitted by Anopheles mosquito. It's a major international health problem. I mean, it's just incredible. We don't even realize it. One of the major causes of death worldwide is malaria, HIV, tuberculosis, and the combination together is just catastrophic. Mostly sub-Saharan Africa. Stuff we generally don't see here. 350 to 500 million infections worldwide. 1 million deaths annually. This is what it looks like when you have the actual plasmodium bursting out of your red blood cells. These are great pictures from National Geographic, if you're interested in this, showing what it looks like. Spreading to the next RBC. Fever and influenza-like symptoms, chills, headache, myalgias, malaise. You can get interval symptoms, The most pressing concern is if you're going to be in an area with falciparum, which is the worst. It can be life-threatening. Severe disease associated with seizures, mental confusion, kidney failure, acute respiratory disease like ARDS, death may occur. This guy actually works in sub-Saharan Africa. I think he's a photographer in a rural village. And what he does is he actually just waits till he gets symptomatic to treat himself because he doesn't want to take it every day for years. A risky proposition. Malaria, as I mentioned, Plasmodium falciparum is a medical emergency. This is how you make the diagnosis. You'll see spliced RBCs. You may be able to see it. When do you consider it? Well, if somebody comes back with a febrile severe illness from Africa or even parts of South America, this is the one thing you don't want to miss. It's most likely going to be dengue fever, but you always have to put in the back of your mind, could it be malaria? That's the one thing you probably deal with in your practice. If somebody comes in and has been to one of these places with a febrile illness to your office, consider possible malaria. Ask them if they took prophylaxis. About 50% of people who take prophylaxis take it incorrectly. This is what some of the endemic areas are. This is in Southeast Asia. I think it's, I can't remember exactly where. This is a map of malaria in endemic countries. They've shaded in all the countries. Certain parts are going to be higher risk than others. Depends on where you're going. I actually took Malmero when I went to Iguazu Falls. Because I was worried, it's just not worth the risk. All throughout sub-Saharan Africa, parts of Asia. And by the way, HIV with malaria is an incredibly potent killer. The viremia increases twofold at least with people who have HIV with concomitant malaria. It's a major health problem. It sounds so strange to us, but it's one of the things. If somebody comes in and you think they have malaria, this is one of the things even I would ask for help. This is not a common thing to see. I want you to be aware there's a CDC malaria hotline. I bet you if you just Googled that, you'd find it. You just call them up. These are people who will probably see it on a more regular basis. It's a medical emergency. These people, if you think have malaria, the P. falciparum, you need to be hospitalizing them, giving them aggressive fluids, monitoring them closely, and treating them. The treatment is usually a atopical proguanil or artemether lumefantrine, which I have trouble pronouncing. How do you prevent it? That's the easiest thing to do. It's just basically just don't get it. Mosquito netting, you can see these people in Kenya are wearing mosquito netting. Obviously, if you want to spend your whole life doing that, it would be cumbersome. Atopical proguanil is Malmero. It's probably the easiest and most tolerable medication. The problem is there's no data in pregnant women. Most people tolerate it just fine. Doxycycline. The problem with doxycycline is that if you're going to be on one of these trips, you're going to probably be out in the sun all the time. So you're not going to be wanting to take something that's going to make you photosensitive. Other side effect issues. It used to be that people would use something called malaria. Is anybody taking malaria? Or methylquine? There's a 5% chance that you'll get psychotic. Yeah. I don't know about you, but I personally don't want to get psychotic in a third world country. So it's uncommon, but there's a risk. So I'm just pointing out that Malmero is an incredibly great drug. It's a newer drug. It just went generic. So it's actually much, much cheaper, about half the price. I think I gave somebody like 28 days worth. They got it for like $180. Okay? Here's the most common thing that people get when they travel. It just ruins your trip, you know? 30 to 70% of travelers will get traveler's diarrhea. And it used to be said that if you just boil it, you peel it, forget about it, you're okay. It turns out that that doesn't always work. Bacterial pathogens are the predominant risk. Most common is enterotoxigenic E. coli, ETEC, and there's an associated syndrome called HUS, which I actually did see somebody with at a local hospital here. She had to be hospitalized and treated with additional platelets and hemodialysis. It was a total mess. She made it out okay. I think she got it eating that some buffet. So obviously it's spread from fecal oral. People are just basically not doing the hygienic manners that they need to be doing when they prepare food. The high-risk areas are not here, but it happens. Asia, the Middle East, Africa, Mexico, Central and South America. In general, they just don't have This is just a map form of that. The refrigeration capabilities in some of these places. And so what I recommend, this is how I think I got sick, is avoid buffets if you can. And eat piping hot food if you can. If the water's been boiled, the food's piping hot, it's unlikely you're going to get sick. If you have a buffet that doesn't look like it's that well refrigerated in a very hot, humid environment, you're putting yourself at a higher risk. Okay. Sudden onset of mild cramps, loose stools, severe abdominal pain, vomiting, diarrhea. You can avoid it also by using alcohol-based hand cleaners, freshly cooked and serving piped hot food, as I mentioned. Avoid things that are associated with non-potable water, like fruit juices, ice, milk. And another thing that most people don't realize is if you actually take Pepto-Bismol daily, it can help prevent it. So that's another tip you can pass on to patients or the travelers. Taking Pepto-Bismol can be actually preventative, it can actually be curative in some manners. It has some antimicrobial properties. Whether or not lactobacillus or Saccharomyces probiotics will help, it's inconclusive. Prophylactic antibiotics used to be a way that people would take ciprofloxacin during their trip. It's generally discouraged. It increases antimicrobial resistance. Treatment is with ciprofloxacin for about 3 days. You may be able to get with less. Depends on where you're going. There's some parts of Southeast Asia. You may want to consider using azithromycin 1 gram PO times 1 instead, because that's actually going to help prevent or alleviate the resistance issues that are accumulated with fluoroquinolones. Anti-motility agents are okay, like loperamide. Oral rehydration therapy is rare. Children, you'd have to consider this more often, and most people don't need to be rehydrated aggressively with oral rehydration salts if they're healthy adult. So we touched on this, how do you prevent malaria already? Diarrhea, we touched on altitude, Diamox, acetylbromide, motion sickness, you can consider prescribing scopolamine or Dramamine. You want to make sure you have sufficient time, I'd say 30 minutes to counsel a patient. Make sure that they understand where they're going. Any medical care abroad, if they have somebody with chronic illnesses, they may want to consider a way they could get medical care if they had to. Awareness of common notices, make sure you check what's going on before they leave. Air travel and jet lag. Jet lag is one of those things that's hard to prevent. You can probably get some improvement in your symptoms by taking something like melatonin. For the first few nights when you arrive, try to reestablish a general sleep cycle associated with the time zone you're in. You use caffeine as an adjunct in the morning, that usually good after midday. People will oftentimes fall prey to things such as dehydration and stroke, hypothermia and frostbite. Water recreation, you have to be aware of drowning accidents. Don't go diving the first day you get there. You're probably going to be exhausted. Bottled water, if you can find it. There are several other things you can do. If you can boil the water, you're going to be at less risk. And there are several outlines in the CDC guidebook about things you can do to actually decontaminate your water with iodine if you don't have close access to boiled bottled water, hiking, trekking. Okay, vector precautions, use DEET. Treatment of adipose with permethrin can help prevent getting bitten by mosquitoes. Air conditioner rooms are nice if that's what kind of trip you're going on. At the end of the day, if you're hiking and doing stuff outside, consider inspecting yourself for ticks. Make sure you don't have it. Prevalence of STDs depends on where you're going. Unprotected sexual workers. Consider not getting tattoos or body piercing in third world countries. Seems like common sense, but some people do it. Rabies depends on where you're going. Injury and crime, I think I touched on. This is actually interesting. A travel emergency kit. You might want to consider bringing a copy of your medical records and an extra pair of glasses. Bring your prescription medications. Bring your analgesics, Pepto-Bismol, Band-Aids, gauze, bandages, tape, and ace wraps, insect repellent, sunscreen, and lip balm. And here's another idea. You don't have to see a doctor after you get back. But it's something to consider, especially if you have some fevers, chills, sweats, or persistent diarrhea more than a week or two.